Welcome to virtual visits at the New York Academy of Medicine Library. I'm Arlene Shaner, the Historical Collections Librarian at the Academy, and I'll be sharing some highlights from the library's collections with you in this virtual tour. Our library has over 550,000 volumes and many other materials, and all of them help us learn about the history of health and medicine. Visit us online anytime to learn about the library and explore more of our resources. June is Pride Month, and thinking about the New York Academy of Medicine's complicated history of engaging with issues related to the LGBTQ community sent me into the Academy's archives and the library stacks to uncover some of that story for this virtual visit. For decades, the library used its own homegrown system to assign subjects to books in the collection. Everything about sex and sexuality was shelved as S102, which was described as sexual instinct, and anything that treated non-heterosexual relationships was described as an inversion of that classification. While some of these books were advice manuals, many of them focused on a more medicalized view of sexuality, rather than thinking about the whole range of human experience, and a large number were only accessible to physicians and not to anyone from the general public. In the 1930s, though, the library was thinking more broadly about this part of the collection. Thomas N. Painter, who had been in correspondence with Archibald Mallock, the Academy librarian, and with Alfred Kinsey, loaned the library a number of his own books related to homosexuality, and then provided funding for what was to have been a major bibliography. Painter had already started the work, and the library hired a researcher, Gershon Legman, to continue it. 6 card catalog drawers with over 6,000 citations can still be found in the reference lobby today. But somehow the work was never completed. In 1942, Painter released the cards to the Academy for care and safekeeping, but in 1944 the relationship with Legman foundered, and both Painter and Robert Latu Dickinson, who had been working with a committee of volunteers on making access decisions about other parts of the sex book collection, severed the connection. Painter later took back his books and gave them to Alfred Kinsey at Indiana University instead. The 1950s witnessed the founding of organizations dedicated to gay civil rights. While the Academy did not subscribe to the Mattachine Review or the New York Mattachine Society newsletter, a few informational pamphlets from the organization found their way into the collections and are still here. As we can see from this pamphlet, the Society was dedicated to education, research, public relations, and social action. And this one reminds readers that even if they are not aware of it, they have gay friends, neighbors, and family members who are useful, productive, and respected citizens and deserve to be treated with care. But 1964 witnessed a darker moment in the Academy's history, when the Committee on Public Health published a report on homosexuality that called it an illness. The committee had been engaged in a study of venereal disease and what they called salacious literature, and the subcommittee that addressed homosexuality was an offshoot of that work. Concerned that medical professionals had not taken a public stand on homosexuality, the subcommittee looked to the Wolfenden Report, published in Great Britain in 1963, as a model. But the authors of the Wolfenden Report had, in fact, refused to call homosexuality an illness, writing, "We feel bound to say that the evidence put before us has not established to our satisfaction the proposition that homosexuality is a disease." The Academy's report drew the opposite conclusion, stating that homosexuality was an illness that could sometimes be treated, but which could in some cases also be effectively prevented. The Daughters of Bilitis, the first lesbian civil and political rights organization, swiftly responded to the report in their journal, The Ladder. Even though the library did not subscribe to this periodical, 4 sample issues from 1964 are in the collection, and they include the August issue. An editorial by activist Barbara Giddings took the Committee on Public Health to task for its positions, calling out the report as inept, poorly researched, and a disservice to the public it was meant to inform. The issue also printed a letter that the Daughters of Bilitis sent to the Committee on Public Health that June, again expressing disappointment at the sloppiness of the report, but inviting committee representatives to their annual convention to learn more. This letter is known only from its published version, as the committee did not think the original was important enough to retain for the archives, and I could find no evidence that anyone from NYAM attended the convention. Something the Academy did not acknowledge was that gay and lesbian physicians had been elected to fellowship for decades. Shown here is Sara Josephine Baker, the first head of New York's Bureau of Child Hygiene, who became a fellow in 1904. Baker lived with the writer and Hollywood screenwriter Ida Wiley and eventually retired with her and Dr. Louise Pierce to a farm in New Jersey in the mid-1930s. Howard Jr. Brown, who served as the first head of the New York City Health Services Administration under Mayor John Lindsay in the 1960s, resigned from that job because he thought a New York Times reporter was about to expose him as a gay man. Brown had been a fellow of the Academy since 1958. In 1973, he finally decided that the time had come to tell his own story publicly, and he disclosed his homosexuality at a symposium before an audience of 600 physicians. His announcement resulted in a front-page New York Times story and coverage on all the local television stations. Many other publications wrote about him as well, including the Medical World News, seen here. By the end of the 1970s, the library was purchasing books that took a more positive approach both to gay patients and to gay physicians, and this book, edited by Richard Green, contains a chapter devoted to each of these topics. In his editorial remarks at the beginning of Chapter 8, Green calls for the delivery of a doctor's best skills for all patients, and Alan Bell, the chapter author, reminds us that someone's sexual orientation is only one part of any person's personality, and that physicians should be treating people as the complex individuals they are. Green also remarked on how difficult it remained for homosexual physicians to reveal themselves in a comment that preceded the following chapter by Henry Messer that addressed this issue. Messer wrote, "There are many types of physicians. Some, male or female, love a person of the same sex. Most are equally dedicated and equally concerned." Over the last 25 years or so, the library's collections have definitely broadened, and the shelves hold books that take a much more positive and inclusive stance on the LGBTQ community. This 1998 book for adolescents contains a letter to queer kids that emphasizes that there is something wrong with a society that makes people feel guilty for loving each other, but that the thing to remember is there's nothing wrong with you. And this 2001 report on midlife and aging calls on activists to seize the opportunity to illuminate the concerns of older LGBT populations in order to promote change and decrease persistent discrimination related to sexual orientation, race, gender, and or socioeconomic status. Our more recent materials can only be found online, as the publication of reports and white papers has shifted further into the virtual environment. And here are two reports issued by MetLife and the American Society on Aging, which undertook the first U.S. national survey of lesbian, gay, bisexual, and transgender baby boomers in 2006, and did a follow-up survey 4 years later. Other reports examine the systemic racism and homophobia faced by Black LGBT individuals and their families, and call for smart policy solutions to address those problems. And here's the first Healthcare Equality Index, issued in 2007 by the Gay and Lesbian Medical Association and the Human Rights Campaign Foundation, to create a national standard for equal treatment of gay, lesbian, bisexual, and transgender patients and their families. And a couple of pages from the 2014 report, where the emphasis has shifted from creating that standard to promoting equitable and inclusive care. More work remains to be done to make both NYAM and American society at large more equitable and inclusive for the LGBTQ community. But as always, I want to remind you that if you want to do research on this or other topics related to medicine and health, you can always find information and assistance at www.nyam.org/library.